Hi, I'm Gloria. I will be doing an instructional video on vital signs. I have my classmates with me, which is Rebecca Marsh and Lupe Morfine. So we are going to simulate that we are at a nurse's station, and this is the patient's chart. We will go ahead and open it up. We would verify obviously the patient and the orders to obtain vital signs. So now, and of course the room we're going to be going into. So we're going to go ahead and come in. We're going to go ahead and do this. So we're coming in. Knock knock. Hi, Mrs. Marsh. Hi, I'm Gloria from Respiratory. I'm here to take your vital signs. So at that point we would go ahead and gel in. We would put on our gloves. We would come over. We have to verify that we have the correct patient. We would verify by asking the first name, last name, and the date of birth. Mrs. Marsh, can I please see your armband? And can you verify your first name, last name, and date of birth?
Rebecca Marsh, 5389.
Good, thank you. So at this point, if the patient was laying down, we would bring up her bed to obtain the appropriate vital signs. Just because we're going to be doing blood pressure, we're going to be doing heart rate, respiration, and we're going to be auscultating, which is also known as listening to the lungs. She's in a sitting position. So can I please see your arm? We check the pulse by feeling for the radial artery, and we would count that. You could count it by 15 and then time whatever number you get in those 15 seconds. You would times it by 4, and that would give you your beats per minute. For respiration, we would count again for another 15 seconds. Whatever number you get from those 15 seconds, you would multiply times 4. Okay, thank you so much. Now we would go ahead and take a blood pressure. The arm of preference is your left arm, since that's where your heart is at. What you do is you place the head of your bowel against her artery. And lastly, it would be followed by breath sounds. When you do breath sounds, you want to start with your back, the lower back, and you work your way up into an S symbol, and then you would come up to the sides, and then the last hearings would be on the front part of your chest. Okay, can I have you sit up, please? Take a good deep breath in with your mouth open. One more time. 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 Go ahead and breathe normally. I'm going to have you lift up your arm right here. Take a deep breath in. Do the opposite side. Take a deep breath in. Deep breath in. And one more time for me. Very good. Okay. Mrs. Marsh, is there anything I could do for you?
No, that's it.
Okay, thank you so much. If you need anything, again, my name is Gloria. Just let your nurse know, and I'll definitely come back and help you.
Okay.
Okay?
Thank you.
You're welcome. Okay, so at that point, we've taken her vital signs, and we asked if we could do anything for her or the patient. We go ahead and take off our gloves, and we have the gel out. We come over to the nurse's station. We'd go into the patient's chart. We are going to write the date, the time. We're going to write down her 4 vital signs, which consist of blood pressure, respiration, pulse, and breath sounds. And so that's how you would take the appropriate measures for obtaining vital signs. Thank you.